This session aims to contribute to answer and discuss the following question. Has One Health been integrated disaster risk reduction, and should it and can it be further integrated? What are the key challenges of working across different hazards, sectors, and timelines in warning systems? And how can we overcome them? What can we learn from each other? To answer this question, this session gathers representatives who have worked in different government departments, sectors, and hazards to obtain different perspectives of what One Health means for disaster risk reduction and warning systems and how it can be implemented. So I have the pleasure to have today Virginia Murray, who will be joining us soon enough, which is the head of Global Disaster Risk Reduction for the UK Health Security Agency. Professor Grant Stentiford, Chief Scientist at CIFAS, Center for Environment, Fisheries and Aquaculture Science. Dr. Alex Tasker, Senior Lecturer in One Health Trusted Research Environments for the University of Bristol, and also recently finished his fellowship with Cabinet Office. And finally, while she cannot be here in person with us, she has very kindly provided a video recording online. Professor Dame Sally, UK Special Envoy on Antimicrobial Resistance and a global advocate against the fight against AMR and a global leading figure in health. So thank you all for coming today. It's a pleasure to have you all here. And we also have to have some interaction in this session. So I ask all of you, if you can please look at the questions that we'll have soon enough and try and interact with us. We want to get to learn from you as well. So please share your insights with us. So before we start, I'd like to ask one question. But you have to go to this number before, which is, what does One Health mean to you? If you go to slido.com, it's very easy. You can type it and you type this number. Should be here as well. We'll get the answers coming in soon enough.
We can add this as well.
Yes, please. Thank you. Here we go. Happy to see that it's working. You never know. I think integration is the key word of this slide. So to recap, One Health was defined by the One Health high-level panel of experts formed by the World Health Organization, the Food and Agriculture Organization, the World Animal Organization for Animal Health, the World Organization for Animal Health, and the UNEP, the United Nations Environmental Programme, which joined the quadripartite, as an integrated and unifying approach, which you're right, that has key principles such as stewardship, equity, balance are the forefront. And this new definition that came in 2021 marks a substantial shift from thinking about One Health mainly as infectious diseases and animal and veterinary and human medicine, but also to think about it in terms of integrating further the environment and the welfare of non-human animals and the environment as important as human welfare and inseparable from us. So I'd like to start now with the video recording by Dame Sally Davies, who will look at this session from the lens of AMR.
Like COVID and flu, AMR, antimicrobial resistance, is complicated, and it's not just limited to humans, but animal health, the food chain, and the environment are all at risk. So clearly, such a complex issue demands a collaborative and ambitious approach to tackle it. And we must put One Health at the heart. Why? Well, AMR is already impacting lives and livelihoods, families, their communities, macro and microeconomics. AMR is killing people globally right now, and in 2019 was the third leading underlying cause of global deaths. That's more than malaria or TB. Harrowing new data shows that over 1.2 million deaths were directly caused by AMR in 2019. Let's put that in perspective. HIV caused 860,000 deaths in the same year. health and environment are inextricably linked. A new study released in August shows that increasing levels of air pollution correlate with increasing levels of AMR, with almost 500,000 premature deaths globally in 2018 linked to AMR potentially resulting from air pollution. In fact, inhalable particle pollution, PM 2.5s, seem to contribute to AMR even more than antibiotic use or access to drinking water services in this study. Right across the environment, AMR is driving biodiversity loss and vice versa. Rivers are increasingly polluted to toxic levels. Microplastics are harboring AMR bacteria and destroying habitats, and sea animals are being found with resistant bacteria inside them. In fact, last year saw a major new study of over 250 rivers from more than 100 countries, and they showed that over 1/4 of these rivers were polluted to toxic levels from antibiotic residues. Not just in low-income countries either, but close to home in the UK too, with Glasgow being among the most polluted. That puts drinking sources and animal habitats directly at risk. With this bleak picture the data depicts, we've got to use the evidence to inform our national and regional actions. It's particularly important we're able to point to the impact of AMR on our interconnected systems, with AMR both driving and being driven by negative externalities across human, animal, and environmental health systems, including on productivity. What happens in our environment directly impacts the health of humans and animals. In our interconnected world, security, sustainability, and stability of humans, animals, plants, and the economy are at risk. Our treatments are becoming less effective due to their overuse in humans and food-producing animals, both terrestrial and aquatic. That's fish farming. Our dependence on antimicrobials has tilted to becoming so excessive our systems are now unsustainable without them, causing destruction and weakening health security and biosecurity. We all recognise antimicrobials have been used to compensate for poor management and infection prevention in food-producing settings and to promote rapid growth for a faster route to market. As global temperatures increase, bacteria will evolve and be more likely to develop resistance. Meanwhile, displacement, whether from conflict, climate disasters, or loss of habitat, create conditions of overcrowding and poor sanitation. These areas become sentinels of infection and breeders of AMR. To properly tackle AMR, we need a greater understanding of its drivers and impacts, and to collaborate in doing so. But currently, we lack surveillance capacity globally, so our health, food, animal, and plant experts are flying blind on how and where to place their interventions. And of course, we need to strengthen our prevention of AMR to begin with. We currently lack adequate water and sanitation infrastructure across the world, so infections spread. They're spreading fast. While interruptions in health services and diagnostics during COVID-19 have led to levels of TB rising for the first time in 2 decades. It should be unacceptable. The insights from the evidence we do have can and should help to incentivize action and disaster risk reduction at local, national, regional, and of course, the global level. To mitigate AMR, we need to investigate smartly for the future and invest in systemic solutions such as infection prevention and control, improved sanitation and access to water, and R&D for diagnostics, novel therapeutics, and vaccines. And hopefully, the interventions and infrastructure that we need to tackle AMR will also build our capacity and capability to tackle other future global challenges, including pandemics. AMR adversely impacts every part of an inhabitant of this planet, our planet, epitomizing an interconnected problem needing holistic solutions. So it's only by collaboration and harnessing affordable innovation that we can really ensure the survival of our food chain and environment. That means the survival of our race. The bottom line is really simple. We've got to prevent, control, and treat infections. We, the world, can choose to produce and consume differently to preserve our antibiotics. There are inspirational examples from all corners of the world, of course, of how people are doing their bit to manage and reduce the risks of AMR disaster. Our own UK Fleming Fund is a major international aid investment dedicated to AMR, supporting countries across Africa and Southeast Asia to build laboratory capacity, infrastructure, and the capability to generate data, share data, and use that data to inform national and global decision-making. Across 24 countries, we're bringing evidence and people together to support countries with lab equipment and skills. For example, in Bangladesh, we're piloting a mobile app which, for vets in the field, optimize prescription practices for poultry. This is giving farmers access to expert advice and the tools they need for diagnostics and treatment. And it can also be scaled up to more countries. Meanwhile, in Uganda, our Fleming Fund investments are enabling local researchers to gather 9,000 samples from livestock and people across Uganda to demonstrate how resistant bacteria transfer between humans and animals. This is really important to understand, and with this evidence, researchers will be able to convince policymakers, at least they should be able to enact regulations curbing the misuse of antibiotics in farming. Surveillance has to happen at every level. So I'm really proud that the inaugural Trinity Challenge, which I set up in 2020, are supporting as a prize winner the UCL team with their Sentinel forecasting system for infectious disease risk. You probably all know about this integrated real-time platform that's forecasting and managing infectious disease risk for Public Health Agency, first for Lassa fever in Nigeria, before then expanding across more geographies and diseases. By connecting frontline healthcare workers, hospitals, labs, and public health institutions, I believe their solution can deliver efficient coordination, robust data sharing, and real-time analytics for risk forecasting and rapid response. But we need far more innovation for preparedness and prevention. That's why, through the UK's Global AMR Innovation Fund, we're co-funding with the International Development Research Centre of Canada, IDRC, some innovative projects to reduce the use of antibiotics in farming, including nanobubble technology, also known as fish jacuzzis for fish farms, aquaculture in Southeast Asia. A One Health approach means all sectors working together, which is why under the UK's G7 presidency, health and climate ministers committed to work together to build up knowledge of AMR in the environment, explore international standards on safe concentrations of antimicrobials released into the environment from pharmaceutical manufacturing or even healthcare facilities. There is actually a hospital in Scotland only prescribing treatments that they know are manufactured in an environmentally friendly way. More research, evidence and monitoring of the impact of AMR on climate change is needed, and we need industry to step up and play their part to ensure compliance with the safe limits of antibiotic pollution too, using the AMR Industry Alliance's target levels as a starting point. Progress by a few shows what's possible. It is possible. With Shionogi and GSK leading the way in tracking and requiring compliance from suppliers, we're doing well as a start. However, only 5% of third-party manufacturing sites are reported as compliant with limits on antibacterial waste disposal. Not good enough. We need companies to use all the levers at their disposal to ensure limits are set, assessed, and enforced at all the supply sites. Collaboration across all sectors is clearly vital and key for disaster risk reduction. Through a collaborative and multi-sectoral voluntary approach to antibiotic stewardship in livestock production, I'm really proud that antibiotic sales for food-producing animals in the UK has more than halved since 2014, including a 6% decrease even since 2020. And over the same period, the use in the UK of highest priority critically important antibiotics in food-producing animals has reduced by 83%. Well done. This makes the UK one of the lowest users of antibiotics in agriculture amongst those countries with significant livestock farming industries, yet all the while maintaining productivity. You can do it. It's a testament to collaboration with the task force of farmer and vet reps, driving ownership, identifying barriers and sharing solutions. And data played a vital role here too, as the British Poultry Council was the first UK food-producing animal sector to develop a data collection platform on antibiotic use. With this information from over 90% of the industry, the industry could speak from a position of knowledge and deliver a strategy for reducing antibiotic usage. You need vaccines, you need cleanliness. We all know what's needed. And it's not just governments who have a role on reducing disaster risks. We can't forget about consumers and investors. Alongside FAIR and the UN Principles for Responsible Investment and the Access to Medicines Foundation, our UK Department of Health and Social Care launched the Investor Action on AMR initiative, and now we have the Universal Ownership Programme coordinated by Cambridge University. But in the first, over 16 investors with a collective asset portfolio exceeding $15 trillion are aligning with global best practices on AMR by incorporating AMR into their ESG standards. And at Trinity College in Cambridge, where I am the master, my students are becoming activists, tabling resolutions for companies like McDonald's to eliminate antibiotics from their supply chains. Globally, we're already in a stronger position of coordination than we've been previously too, with the formal integration of the UN Environment Programme into the quadripartite of WHO, FAO, World Organization for Animal Health and UNEP. We need, though, to ensure that this translates into community action everywhere and that overlaps are acted upon. The UN Global Leaders Group on AMR, which is chaired by Prime Minister Motley of Barbados and on which I'm privileged to sit, is working to ensure a One Health approach underpins any legal instrument that countries are currently negotiating to bolster global preparedness for the next pandemic, whatever that may be. And with the high-level meeting on AMR at the UN General Assembly now scheduled for September 2014, we must seize the opportunity to be louder and bolder and work together to bring voices from every sector and every country to the table to strengthen One Health commitments and governance. We need everyone, from clinicians, nurses, doctors, dentists, farmers, vets, to researchers and investors and the public to join together to raise awareness of AMR. Why do cancer patients not demand better? They get lots of infections. We all need to act as antibiotic stewards and push for action at every level. We will need all of you to help do so. We all have a stake in this, and we all have a role to play in it. So I invite you to join me on this journey. Thank you.
Thank you, everyone. Is it working? Hello? No, hello? Great. Hello? Hello? Yeah, perfect. Thank you, everyone, for listening to this. I think the main key insights that I take from this is that the example of AMR showcases very well by exemplifying the links of AMR with air pollution, water pollution, fish, farm fisheries, and sanitation, etc. The importance of looking across these sectors in order for warning systems in order to be able to assess the drivers and the different impacts. And second of all, I think AMR is a great example of how we need to stop thinking about disasters only as fast onset hazards, but as well as slow onset hazards and creeping environmental changes, which are disasters as well on their own right. So thank you. I'd like to move on now to the presentation by Virginia Murray. Virginia Murray is a public health doctor committed to improving health emergencies and disaster risk management, and she's chair of the UNDRR ISC Hazard Classification and Review Technical Steering Group. Thank you so much for being here today, Virginia.
Claudia, thank you. How do I get to my slides? Straight on. Okay, no, we did. Yes.
Like COVID,
Moving on.
Okay,
You just do like this.
thank you very much. Thank you. We've all been trying to set up properly. Claudia and I were talking only yesterday afternoon to try and make sure that the slides got through. So to me, One Health is a fascinating concept of real import. I know it's been around, Claudia, for some years, and I know that we have colleagues working in UK Health Security Agency who are much involved with it. But I think there's an awful lot more to share on the fact that we have the UN Office for Disaster Risk Reduction, and obviously you've heard from Mami and Laurie earlier today, and the International Science Council, which is the global voice for science under UN ECOSOC, their hazard information profiles. And I think that's going to be very interesting to consider. So I went back to the plan of action, the joint plan of action, and thought about it again, and also looked at that wonderful diagram you put up already, Claudia. Thank you so much. But to me, I think what's really coming through very strongly, although the plan of action doesn't include the UN landmark agreements particularly, it mentions the SDGs, but it doesn't mention the Paris Agreement, or indeed some of the disaster issues that are related to the Sendai framework. So I think there's a few things that could be done for the future, if that would be helpful. So the Sendai framework is this really powerful 2015 resource that we've heard so much about from Mami and Laurie. And it's really important that we know that disaster risk reduction has a UN mandate, which was agreed at the UN General Assembly, adopted by the whole of the UN General Assembly in 2015, just as the SDGs and the Paris Agreement were. So that's why 2015 has been such an incredible year. And we know that there's this global outcome, the guiding principles, the 4 priorities for action, and the 7 global targets that were discussed earlier. So they're all there, but now we need to use them. And part of it is to do reporting under the Sendai Framework Monitor, which is absolutely key that every UN member state should do this twice a year to make sure that we upfill all the work that needs to go on about what's going on around the world. But one of the things happened that when we were looking at it in 2018, it became quite apparent that people just really struggled to understand what all hazards meant. It's not an obvious term. Although it sits inside the Sendai framework at paragraph 24J, it's about to strengthen technical and scientific capacity to assess disaster risks, vulnerabilities, and exposure to all hazards. So have we got this right? Have we got something that would work? Well, we went back to the agreed statement that was developed for paragraph 50, which was the terminology that was published, and that was really very useful. But what we found was that it wasn't as clear as it should be. And countries didn't know quite what to report on, and I think we're quite considerably under-reporting, as probably the UK was. So I was given the great privilege to ask to set up a group with others, and many were suggested, to develop the Hazard Definition and Classification Review, which we published in July 2020. So in the midst of COVID, this work was going on. And the people who made up the incredible work was obviously UNDRR and its many partners. So there were over 40 UN members, over 40 UN agencies, intergovernmental organizations who contributed to this huge effort, one way or another, either offering a hazard or offering to engage or being actively involved. And many of them were quite incredible with their enthusiasm. So the World Meteorological Organization, who's been doing this type of work since the 1980s, was really, 1890s, I'll get it right. That seemed to be really important that we got some of their thinking about it. And obviously WHO, which has also been going back a long time trying to define so many of these hazards. And the Food and Agriculture Organization, which of course is so much at the heart of so much of the One Health work, that they too were there. But so were many others. And then we had the International Science Council partners. So we had all the integrated research on disaster risk, our co-data, our our global earthquake model, and many others. But we also included a group which I thought was really interesting, which was the business partners who come under the Sendai framework. So these were the people from the Insurance Development Forum. And if we pay for insurance, we would assume that they have good definitions. So that seems to be a really great idea. And then to me, I was really concerned that we got to the communities, which is why we went to the International Federation of the Red Cross, Red Crescent. And it looks like a small group, but it's about 30, with many arms out to others. But what was incredible were the number of volunteers, and then the incredible network of people who came in to help. There were about 800 people in the end who contributed one way or another. So an incredible achievement in the midst of COVID. And I thank Kansa, who's in the audience, very much for her help in trying to keep me on the straight and narrow. So thank you, Kansa, for all your help. That was quite an adventure. But what we did was to do a huge think about all the different things. We had the UK definition of hazard, the UNGA, the definition of hazard as a process, phenomenon, or human activity that may cause harm or damage. And to do that, we looked at every scientific hazard glossary we could find, and UCL came up with many of them. So thank you, UCL, yet again. But we also looked at as many of the UN glossaries as we could find, and we really followed those through. We looked at the IRDR peril classification and all sorts of other things. We did surveys of scientists, we did consultations with many, and came up with an inclusion criteria. And in the end, we had 302 hazards. Now, these 302 hazards then needed hazard information profiles. So let's have a look at them here. You'll notice that, that there are 60 hazards in 9 clusters for the meteorological and hydrological hazards. And those are the ones that's what I think early warning for all is focusing on. And that worries me because that's actually only a small part of all the hazards, in my view. We were very pleased to get the extraterrestrial in, and now increasingly space weather's coming in. But the geological hazards, the other classic, and of course, think of Morocco, poor Morocco. What a terrible time they're having with all the earthquake risks, but also the volcanic risks and other geohazards. Increasingly, the environmental hazards are coming in with the wildfires, shore level, sea level rise, and things like microplastics are coming in very strongly in that group. And the chemicals, I mean, there are millions of chemicals, but we ended up by just having 25 hazards. A lot of them are shuttles to bring in many other hazards rather than just some, but we've got a structure in there. But what was really exciting was we included biological, because that was all thought to be health, outside what normal people did in disaster risk reduction. It was really fascinating. I must admit, COVID-19 sadly helped in this story because of the great pandemic of that. But what it really did was to make us engage, to get so much more health, to be seen as normal within the whole story of hazards. The technological hazards in the Sendai framework, there's a lot on man-made hazards, and we really had a tremendous time engaging with many on radiation. So we've got the chemical, biological, radiological, nuclear, and explosives. We've got construction failures. Oh, is there something called a little problem with our cement in schools and places? Oops. Infrastructural failure, really important cyber hazards. ITU were amazing on the cyber hazards. There's also the industrial failure, the waste. Gosh, COVID's really generated waste, marine flood, and lots of other things. But to make it complete, although it's not part of the Sendai framework, we were allowed to include the societal hazards. So you get the conflict, the post-conflict, behavioural, the economic ones. And I think economic is really pretty important these days. And for each hazard, there was a primary definition that was agreed. Everything should be publicly sourced. Everything should be at the highest possible level, preferably a UN definition, really clearly simple with the scientific definition that's preferably measurable, modelable, and statistically relevant, with the metrics wherever we could find them, numeric limits, defined guidelines, preferably global, but regional where acceptable. We added the key relevant UN conventions on definitions and multilateral treaties. But the thing that's going to matter, I think, for early warning for all are examples of impacts, outcomes, and risk management. How are we going to do this? How can we make early warning change? And then, of course, we've got the coordinating agencies who have been so brilliant to help us. This is just the zoonotic diseases. I thought you'd like to have a quick look at it just to see what it looks like. WHO is yet again a star. They've done so much on so much of this work with so many. Dengue is there as well. And that's a very useful definition. Avian influenza, you'll notice that here we have FAO, WHO, and, well, OIU's changed its name, but that's another reason for updating these things. But the point is, we were working together with many. And I thought you might like to have a look at rabies too, because that's not something that would normally be included because it's single cases on the whole. But because it's such a problem, we were allowed to include that. And we got AMR. And AMR was really important to try and get much more engagement on many things. And then we got the levels of contaminants grant. I thought would be useful for you if you're talking about food and feed. So what were the recommendations? Use this hazard list to actively engage policymakers and scientists in evidence-based national risk assessment processes. So we begin to understand what the hazards are within each country. Look at their disaster risk reduction and risk-informed sustainable development and other actions aimed at managing risks of emergencies and disasters. Very much that investment thought that Mami had earlier. And most importantly, after our really complicated year we've had this year, addressing cascading and complex hazards and risks. How can we link them? How can we count them? How can we understand how they all interrelate? And get a regular review going. So I'm delighted to say that just a couple of weeks ago, we started really on the face-to-face process of this regular review, and we're updating for the global platform in 2025. So we're all ears to hear from you whether we've got it right or not. So any comments are seriously welcome. Why does it matter? Because much to my surprise, DRR and the International Science Council, when we were finalizing this, said these hazard information profiles, these technical reviews supports the Sendai framework, the Sustainable Development Goal and the Paris Agreement because we provide a common set of hazard definitions for monitoring and reviewing implementation. And there's a lot of work going on to see how they cross-link and how they cross-work. Really exciting work. So let's go back to One Health. How does it fit? I think most of those hazards you've been talking about, you know, they're sitting in there. All you've got to do is just open the box and Pandora will arise. But I thought we should mention climate because none of our hazards is a climate hazard. Climate is a driver of hazards. It was really interesting having these discussions with UNFCCC, with WMO and IPCC. And we know that climate is there throughout the thinking that's in the plan of action. So I thought I'd take you to something we published at COP28 last year. I don't know whether you're aware of the 10 new insights in climate science. It's a really interesting report. And there were 64 authors when we published it last year. And I was one of the 4 health authors for the issue that related to new threats on the horizon from climate health interactions. It talks about the impact of climate change on the health of humans, animals, and entire ecosystems are increasingly widespread and new risks are emerging. Oh, is that One Health? Have I got it right, Claudia? I think you got quite excited when we started having this dialogue to see how we could do this. So I thought I'd take you through this. It's an appalling slide. You start with climate change at the top, and then there's some selected risks. We know it's not complete, but it's a very good example of infectious diseases, loss of biodiversity, floods, wildfires, and extreme heat. And what we said right at the beginning was that we have to make sure we've got these surveillance and early warnings systems in place for these, and that it's a multi-sectoral information sharing and action. That's One Health. Okay, what I think. And then selected potential downstream consequences of increased use in pesticides, increased antimicrobial use, decline in ecosystems, decline in food production, increased pathogen spillover, and indeed to change in a range of vectors and pathogens. So what's the type of impact? Mental health. I think we all get a bit frightened by this. Physical health and indeed mortality. And the affected populations are humans, domestic animals, wild animals, and plants. And again, we need urgent policy needs for mitigation, adaptation, and increasing resilience for climate change in all its forms. So what's the next thing? Early warning was discussed. I was very interested to see that Mami thought it was launched at COP28. It was actually launched on the 23rd of March, 2022 on the WMO Day. And I had the great privilege of speaking as one of the 6 presenters. I wasn't doing the early warning, I was doing the early action. I was the health presenter, one of the 3 presenters in early action with a frontline person and a funder. And we will try to get through the message that you can do early warning systems, but let's get the action in place. And of course, we now have the executive action plan, which I know Laurie was showing you a lot of the work about. And that this is the pillar for DRR, which the UNDRR are leading on knowledge. This is the WMO pillar on detection observations, monitoring, analysis, and forecasting. This is the warning and dissemination, which ITU are leading on, and this is the preparedness to respond. So what have I got right? Well, we know we need a plan of action. We know we have a One Health issue. We know that the Sendai framework is crucial. And in the midterm review, which Mami was talking about, One Health is mentioned as a possible new term for the future. We know we have the hazard information profiles and definitions, and we feel we have an opportunity to review and update these. We know we have these 302, which will link to early warning for all. What an exciting opportunity we have. Claudia, thank you.
Thank you so much, Virginia, for a wonderful presentation. And thank you for showcasing the many links between disasters reduction and a lot of work that has already been in place and being done for the last 10 or 15 years. And One Health, which is this new, not so new, but maybe now the forefront concept, and how we can bring them in together in an integrated way. So I now have the pleasure to introduce Grant Stantifor, which is the chief scientist at CFAS. Prior to taking on the role of chief scientist, Grant was chief pathologist at CFAS and also the head of the World Organization for Animal Health Collaborating Center for Emerging Aquatic Animal Diseases. His work has focused on the identification and impact of aquatic and animal diseases on farmed and wild animals, more recently leading to proposals to incorporate One Health principles into sustainable food system design, such as the One Food Project. We're really happy to have you here today to showcase some really practical examples.
Thank you. Well, that's it, everyone's involved with One Health. That's it, you can stop there, I think. Yeah, can I get my slides? I mean, yes. Everyone is involved. I used to ask a question at the start, who does One Health? And most people didn't put the hand up because they don't feel like they're kind of allowed to say that you work in or on One Health. But I mean, hopefully I can show you in this talk that you do. One Health in my world, I work for CFAS. CFAS is a part of DEFRA. It's an agency with scientists, 650 people or so. And this is kind of a common habitat for us. This is a shrimp farm in Thailand. And these people are scooping out dying shrimp from a pond because they've had a diagnosis of yellowhead virus. You've never heard of that, I bet. In this 24 hours ago, shrimp start dying. And if they don't get these things out within 24 hours, they're going to lose the whole lot. Probably, a couple of $100,000 worth of shrimp in that pond, which means a lot of money in nations which are reliant on aquaculture. So this is One Health. This is a pathogen, probably driven by climate, poor aeration in the ponds, maybe a typhoon happened overnight or whatever it might be that took the energy out, and then there was a power cut, so there's no aeration. You end up with this. So, and this affects a lot of people, creates poverty, creates illness, creates societal problems, etc. So it's really clear, go back to the comments now, I think that these diseases are absolutely in the One Health domain. So I would like to sort of propose that the vets medics thing, I'm a pathologist, and what you often feel with One Health is it is a real domain of medics and vets. They're very familiar, very happy with those terms, COVID being a good example. But if you start saying, well, what about One Health in the aquatic world? Or what about One Health in food systems? Or what about One Health in climate change and those sort of broader topics, then it all gets a little bit woolly and people get a little bit nervous about applying that principle to that. But if you actually look at some of the documentation that was just shown in the previous talk, the One Health Plan of Action, which is in the middle, the so-called quadripartite, is recently signed up from the food people, the environment people, the human health people, and the animal health people. They've all said they want to do the same thing. So that's good. But what it does immediately in our brains is just create confusion to think, well, what do I do? How do I get involved in this really complex problem? So part of this, I think, in my opinion, is that we've all grown up in a world where we've become very, very deep specialists and unable to talk to each other. And now we need to take that deep specialism and add ourselves in to that deep generalism required for the kind of big picture thinking that this is going to require. And I think what I would propose, I like the definition on the left-hand side, which says that One Health really comes alive when you apply it to something. So apply it to a problem. If you think about it in all together, it's very difficult to work out what it is. But if we agree that we want to create sustainable food systems like aquaculture or anything else, then we all agree on that, and we can work backwards to the types of things we should apply to aquaculture to apply those One Health principles to it, so we create a sustainable sector. So I like the idea of applying One Health to things rather than it being a subject. It's an approach. Aquaculture, I mean, I don't even understand what's going on in this picture. I don't know why that guy's diving in there. There's no need to be going in, but he's going in. And there's dead fish floating on top of the pond, and you're not aquatic people, but when fish float, that's generally a bad sign for a fish. They generally like to be under the water rather than floating on the top. So the fish are dead. The people around the outside are probably wondering why. Someone's tipping something in the back there, maybe a big pile of antibiotics going into the back to try to solve the problem in the pond. And that guy's going in, I don't know why he's going, just have a look. So this is a classic situation of where animal health, antibiotic uses, pharmaceuticals, pathogens, and people interact. And what we do know is the hazards, some of them were mentioned there, some of the biological hazards especially, take away about 40% of the crop on Earth. Plants, animals, and fish, and so on, is taken away by hazards every year. So if you think about the implications of that, how it funnels through trade, economics, and so on, those hazards, if we can control them, are at the heart of a lot of what we would consider to be One Health benefits. So if you'd speak to DEFRA and other agencies, they would say that high plant and animal health status is critical to try to maintain. So the UK tries to do that really well. Some countries not so well. Diverse hazards, as mentioned in the previous talk, impact food safety and trade. If you've got certain diseases, you can't trade them. So that might stop, even though the animals stay alive, they may not be tradable on the global market. That prevents you making money, and that creates poverty. And there's that 40% loss of animals and plants that are dying on the way to being produced, never made it to the plate, they were never eaten by anybody, but they used up a large amount of human and environmental capital to get there. So lots of waste happened on the process to get nowhere in the end. So again, a One Health issue, biodiversity for climate, that's a disaster. So hazards are right at the heart of that problem. We were talking a lot over the last number of years about how we apply One Health principles to aquaculture. When we brought people into that room, it wasn't just people who knew about aquaculture. In fact, most people didn't know about aquaculture. They were trade people, they were disease people, they were food people, they were all sorts of different people with different skills. And we asked them to come up with a set of metrics criteria which apply to their area, that we could say, well, what would a sustainable aquaculture sector look like from your domain? So I'm a pathologist, that yellow bit's familiar to me. Organism metric 1 at the top there, 1 o'clock. Healthy farm stock, yep, I can do a lot about that. I can help that to happen. But I don't know anything about gender equality in aquaculture systems. I don't know how to create good income for people. I don't know very much about how to get low energy production. I don't know how to protect biodiversity, but other people do. So if we apply our skills to this One Health approach, we can then add in to this overall outcome of trying to create a sustainable food sector like aquaculture. If you put that into action, you can then ask questions in a given nation or given sector. How well are we doing against those metrics? Do we have research in place? Do we have evidence in place to do anything about it? If we have evidence, do we have any policy in place to control it? Yes or no? Do we have any legislation in place to stop that happening in the future? And you can draw these kind of spider diagrams, and it gives the government or the industry a focus about where we need to apply some better evidence generation, better policy, to hopefully replete that wheel in a better way, but taking a One Health approach, and we get to the end point of having animals staying alive and being able to be safely eaten. We would argue you can't do that all at once. No nation does that all at once. So focusing on the hazards, the pathogens really in our case are probably the first point. If you can't keep things alive and be able to eat them, then there's no point trying to produce it in the first place in food systems. So that's a really important first focus. As I mentioned before, if you don't do that, you use up a lot of capital, human and environmental capital, to get nowhere. So it's really important to prioritize on the hazards. We did a process of looking at what the hazards were for aquaculture. They're everything from chemical hazards at the top there, including things like radiochemicals. We've got that issue at the moment with the Fukushima stories around at the moment. Will that affect the tradability of fish in those areas and so on? Through animal pathogens, viruses, bacteria, protists, metazoans, syndromic things that we don't really know what they are, right down to human pathogens. So pathogens that come off the land, norovirus being a good example, it goes into the sewage, goes into the water, filter feeding animals on these ropes. These are mussels on these ropes. They absorb, take up those pathogens, and when we harvest them, they give them back to us again and make us sick. So some of the hazards are from us going in. So we looked at this big long list of the hazards. We thought about the scenarios of aquaculture, lots of different scenarios. Aquaculture is not one thing. You've got everything from artisan seaweed production at the top there, right through to those amazingly massive floating hotels on the water on the right-hand side in yellow. They would be taking about 200 or 300 miles offshore, sunken into the sea. You have a community of people living on the little thing on top of it, who are feeding and keeping animal health together. And when the animals are fully grown, the fish are fully grown in that cage, you bring it back to shore and you harvest the fish. So aquaculture is a hugely divergent sector as well. Hazards differ all over. If you take a single scenario, so the scenario at the top of this figure, you might say, well, I would like to grow oysters in those 3 bays over there, and I'd like to trade them live to the European Union for consumption raw. That'd be a scenario. You can then go through this hazard profiling. You start off on the left-hand side saying, well, actually, you're not controlling any of these hazards very well. You're going to get contaminated animals, which are going to stop you trading them live to the European Union, if that's what you want to do. And if you put risk mitigation into place, you can then shrink that bubble down, and then you can go through with a scenario and you can trade them as you want to. Or change the fact you can't farm them in that bay, or you can't sell them raw, or you can't eat them raw. So scenarios are really important. If you look at how we grow food and make food, a nation like the UK may look like the left-hand side, growing, rearing, capturing, gathering. We do all of that. But if you go to other nations, you've got growing, rearing, capturing, gathering, but the foods themselves are different, but the principles of hazards and how they interact are the same. And where we've got to now, the final slide is, if we can do this for the aquatic domain, if we can control the hazards and stop those hazards stopping us making food, then because those hazards mainly exist in the environment, water and soil and air, then it's likely that many of those hazards may also interact with other parts of the food system that's in that nation. So they're not just affecting the fish that I work on, they may be affecting chicken production or seaweeds or even bushmeat, things like bat in the forest and so on. So we would argue that controlling the hazards that are in the center of this in the environment as best we can, and reducing that loss envelope for hazards on food systems, not only lead to the yellow wheel there, which is saved meals and better human health and trade and money, but because you've reduced the wastage of the food sector, you've also used less space, so you save the species. So biodiversity has metrics associated with the one food model. And because you're using less energy to produce the animals, you also maybe significantly reduce the greenhouse gas uses to make the food that you're trying to grow. So you're having climate benefits from the food sector. So that gives you a good example of why hazard control, people working on hazards at the moment don't think like this. They work on the hazard, maybe chemists in laboratories or pathologists in labs. They don't think about they're saving climate change or saving biodiversity, but hazard control with One Health principles at the heart can do that if we get it right. So I would say my final point is the food system is a pivot around which One Health policies and principles can be applied. And many of us have our interaction with food systems in one way or another. And if you want to create a community of people who really get behind something that's more than just policymakers and big documents written by big agencies, if you want to get people involved, the easiest way to get them involved is talk about food. It's the simplest common denominator we've got between us. Thank you very much. That's our ship, by the way, for us.
Thank you so much, Grant, and thank you for showcasing the power that One Health can have when we're looking at it as a lens to achieve better responses to problems like sustainable food systems. I'd like to introduce now Dr. Alex Tasker. Alex is a veterinary surgeon, development anthropologist, an interdisciplinary One Health expert who works closely with government and practitioners to understand and advance health in areas of conflict, criminality, and displacement. It's wonderful to have you here today, Alex.
Thank you very much. I think, to be honest with you, I've taken Grant's deep generalist idea here a little bit further in that, and I think the joy of where I've come from is that you do sit at these intersections that are required. So the question I've stuck up, if you do the honour of having a go, is there such a thing as an unsurveilled space in One Health? And I hope that I'm going to try and change your mind by the end of this. Are you happy if I potter on and we come back to this one? If we need to? Fantastic. So the title I've given today is The Unknown and the Unseen, Rethinking One Health Surveillance, but the unkind would say thinking about One Health Surveillance, because sometimes we don't do it as well as we could do. And I was going to stick this up first of all as a slide to think about. We're going to come back to this, and hopefully this will become clear. It's not necessarily Grant's home turf I'm talking about at this point. But it's more today about a provocation. Firstly, from a defence colleague point of view, I'm going to hit this at pace because we want to have more time for questions. I can share the slides, we can have chats afterwards, so please forgive that. But secondly, I'm going to run through two quick examples, one geographical, one more kind of political, around why I think this is interesting. And then secondly, I'm actually going to offer some thoughts about how we can improve it, or how we can think about doing it. And I would love you to disagree with me afterwards, if that's right. So please come back hard on this. So the first one we're going to talk about is the idea of permafrost. You've all hopefully come across what permafrost is. If you have a look up here quickly, the thing I like about this map is that the dots are actually settlements. They're communities. They're people, they live, they have food systems, they have all types of belief systems. And on the other side, we can look forwards to around about 2060 and see what's happening. And just above Grant's head, there's a Nanette area there, which is part of the Russian Federation. And this is the Nanette people. And the reason I'm bringing them up is in the Yamal Peninsula, which is where they are, 2016, there was a mass die-off of reindeer from anthrax. Now, look, about 6-7% of the entire population went, huge case fatality rate. They stopped vaccinating in about 2007, so there's a question of whether it was social or not. But actually what we were starting to see is that there are lots of mammoth graveyards around there. Okay, and there's potentially viable anthrax coming out from the permafrost through mountains. Now, a number of you may be involved with this anyway. I mean, it may not be shocking, there's lots of stories out there. But if we look a little bit closer about what One Health means to these very food insecure people, these people are having meat effectively defrost in front of them. You can't eat this bit. What's that? What is it? Tusks. Tusks, awesome. Okay, tusks, we're going to recast that as ivory. And if we look at this, these are international ivory trading networks illegally around the world. So we start seeing how potentially dormant anthrax, which has huge resistance potential, starts to get pushed around the world. Now, to be honest with you, any logistical company would hugely admire this. The ability of that kind of reach and that kind of speed is phenomenal. And if we, for those who are SNA, social network analysis people amongst us, there's some weighted degrees here. And you can see that by weighted area, 5 million tons went through Hong Kong. Belgium, number 3 at that point. And the thing I wanted to point out with this is that these networks are specifically and deliberately very good at subverting detection, at subverting surveillance. Yet I would argue are really important for One Health, are really important for thinking about what the impacts long-term are. And the reason I put this slide up here is that there's a brown paper at the bottom there, you can grab it. What we're actually also finding is that criminal networks and warlords often have really good governance structures. They know their people really well. They're able to act quite quickly. So if we're putting ourselves against these systems, which, you know, arguably ethically we probably should, we don't understand them in the same way. So one of the things I'd like you to think about is how do we engage with these spaces which have different rules, different norms, different standards, and yet are important for the rest of the world. And if we think about the role of surveillance within that, well, actually, how do we surveil these spaces? Should we surveil these spaces? Can we? Or, I'm going to come back to the question, are they already surveilled by the communities who live within them, who understand what's going on, who are trading these things, but in a language or a system or using data that we can't access in that way, or we don't access? And how do we think about that? And then the second one I want to talk about is insecurity and inequality. Now, the WEF, World Economic Forum, there's a nice map here around different types of risk landscapes. You're all probably very familiar with it. We've got everything from collapse of public services, state collapse, cost of living crisis, but also climate change mitigation, digital inequalities. Nice big map there, yeah? Says a lot, says nothing, depending on how you come at it. I'm just going to chuck another map up quickly. And this is Healthcare Access and Quality Index, because this is a Lancet paper. And you can see it's basically a heat map of where access is easy, access to high quality is high. One of the things I find interesting about this map is if you look at the colours, as most of the maps we draw are, there are some nice straight lines in there. There are some really easy boxes that are being ticked, they're being coloured in one colour or the other. And that's an artifact of our research, which helps us understand things, but we need to think quite clearly about. Because if we start using this, as Grant said, in reality, we start looking at the cases that we're interested in, it starts pushing a bit further. So the first one we'll talk about is migration, and it was already mentioned by a colleague here, but also in the opening statements. Well, this is a map that some of you, if not this map, you'll be familiar with ones like it. It's refugees in host countries. And you can see that the burden of refugees, if they are a burden, depending if you class that politically or not, falls to a certain number of countries. And we can think back to that healthcare index. We can think to the idea of health in countries which may have systems which are not capable of standing up. But let's dig a little bit closer into this, okay? So this is IOM statistics, Institute of Migration. This is disaster, IDPs, internally displaced people. Now, for those of you who work with IDPs, politically and socially often marginalised, harder to reach, harder to surveil. And if you do surveil, there's a huge power structure there. And we can start seeing where they're going. But we can push even further. We can move away from disaster and maybe into conflict. And again, there was an acknowledgement at the outset of we need to think about conflict settings. I'd argue that conflict as defined by a country in one area isn't usually sufficient. So we know that these conflict-affected settings, you can see Ukraine at the top there, it's very hard to do surveillance, and I put hard in air quotes there. There are different forms of surveillance going on there. But I'm going to push one further. Now this map is child trafficking. Let's think about how we would surveil the health, disease transfers, political inequality, social ability, mental health of people who are deliberately subverting some of the most vulnerable people in our society. They move into environmentally damaged areas. They are being put to work in environments which are deeply damaging to them and the environment themselves. How can we robustly and maturely engage with the kind of surveillance I think we need to be doing around disasters in these contexts? And now you can see I was talking as a provocation rather than a solution. Just to run back to agriculture, we've had this well covered, but I'm going to bring one up here. Anyone want to guess what disease I'm talking about at this point? Nipah. Okay, Nipah in Malaysia. This is a paper, 1999 paper, but not academic paper, newspaper, for Nipah virus. Now, for those of you who know Nipah virus, it's pretty horrendous. It's a very, very unpleasant condition, but it's highly linked to Socrates fruit bats. Okay, so fruit bat droppings typically will infect various different palm outputs, palm products. People contract it, and there's a very high risk of death. So there were huge culls done of pig populations. Now, do you remember when I talked previously about those countries with the nice sharp lines and the colours we've got? Let's move away from looking like we do and look at it like a bat. Well, it's a Malaysian problem. Is it rubbish? Okay, that green line is where the the Broptus genus of fruit bats, the ones we were talking about. But actually, the dotted, the hashed red line are where the whole family lies. Can we start to see where these risks are moving? Now, these are economic, social, health-based risks of people, which really attract a lot of interest. And yet we're not thinking about this necessarily in the term of where fruit bats would go and how they tie in with those communities which are outside of surveillance or at the margins of surveillance. And particularly if we think about climate in this, well, actually that range hypothetically can get much, much bigger. Northern Europe's still on that map. So actually, even if we take a very localized view, and I wouldn't, we need to think carefully about what it means for us. And then just the last one on these cases, think about food security. Well, this map was yesterday's heat map for food security outlooks. And you can see they've already broken it down here by desertification, excess rainfall and conflict. Now, if we think very carefully about those health system surveillances we saw, we can see that there's a couple of contiguous areas. But again, I'm going to ask you to go a bit further than that. It's not just food systems which are difficult, food systems are insecure. Food systems and agriculture systems are very old. What's being grown here? Poppies makes opiates, okay? Opiates are an absolutely staple part of many local economies. And yet they've become hugely politically important. There have been invasions waged over them to some degree. If you look at Britain's history, it's a particularly dirty one around the opiates, okay? But actually, these kind of farming systems, you have the option to stop them, subvert them, move them in a different area, start their own systems, their own channels, their own processes. So can you see the kind of complexity I'm hoping to bring out? And actually, if we're talking about how we move across sectors, how we collaborate on different timelines, I think we need to be more honest with ourselves about those areas which are most vulnerable, those areas which are most at risk and pose the most risk, where the hazards sit most profoundly, and yet potentially we find it harder to look and harder to see. So on that note, I just wanted to offer a couple of pieces from my experience and from other work that's out there that we can think forward. First one's around uncertainty. So these are two climate graphs. We think we're quite used to these. Nice fuzzy edges. This is where the top and low, high and low, left and right of arc for any of the defence amongst here. Well, actually, I work quite a lot with pastoralists. And they've been quite shrewd managers of risks for about 6,000 years. But they have a very different view to how that risk works. They manage their environments, their animal health, their human health in very, very different ways. What can we learn? Similarly, we can actually look to research. And this is, I don't know if anyone knows Andy Sterling's work down in Sussex. I really like this one. I use it with policymakers quite a lot. He's talking about the idea about uncertainty or risk. And we've got a lot of definitions we've talked about, but on the Y here, we've got the knowledge of the probability of something happening and the possibility of happening. And these are not set boxes. You migrate through this structure. But he's got risk at the top left there, but it goes into uncertainty, ambiguity, and ignorance. How often do we write about our ignorance of risk as opposed to uncertainties or risks? I am not here to promote his work. I don't get paid for it. But at the same time, I am trying to say to the fact that we can think about this in a more mature way. What are we lacking? What do we mean when we start viewing things from the other side? When we become a fruit man, for example, do we know what's going on? And the nice thing about this table for me is often he puts methods in here by which you connect and engage with different areas, because you need different methods, different thinking for each. And just to follow up on that same paper, I quite like this one for my students particularly, because this is science-based advice, okay? And if you look at the bottom here, the economic risk, and these are a review of papers, ranges for any one of these energy options from the sublime to the ridiculous, and yet we don't normally communicate this way. You know, the left and right of arc, we say that, for example, coal is damaging. Well, actually, in this situation, coal has the potential to be less damaging than solar when you're thinking about it in different ways. We can think differently about how we engage with these complex, uncertain spaces. And then the second part of this is co-creation. We've talked about working across sectors, across themes. Well, there's a big question about what co-creation is. These are the kind of communities I work within, and the idea of someone like me sailing in and saying what's going wrong is abhorrent, okay? And it's not co-creation in the sense that they're telling me. We all know this because participation's had a good kicking in recent years. What we need to be thinking about more carefully is how we bring people into these conversations and the power that everyone is given or gives up, more importantly. And this is an example of the One Health Cosmos, for those who haven't seen it. It's quite an interesting because it's got things like media publications in it. I quite like it, okay? But it's written for a One Health audience. This is a cracking paper from 2019. And this is a heat map of where the lead authors come from on One Health publications. Anything we want to comment on that? Everyone quite happy with that? Okay. So again, with all the bias of the fact that these are scientific publications, typically published in English and all this kind of stuff, but this makes me worried. This is what we need to rethink about One Health in some ways. But we can do better than this. This, for example, actually is a Malaysian study on Nipah, again, with the Malaysian authors. And the bit I particularly like, for example, is the red lines are immediately during or post-Nipah. This is what farmers are thinking about. And then we can move forward to 2019, and what are they thinking about? We've got temporality, we've got local concerns driving this forward, which gives us a much better insight of how we can start thinking about these worlds which we need to engage with, and also the people who are doing the thinking. One very pop quiz, which hopefully will illustrate this further, and this is an older paper. Does anyone know what this region is? Any sociologists, anthro people in the room? Oh, wow. Okay, this is Zomia. Anyone come across Zomia before? It's the art of not being governed, James Scott's book. It's basically a collection of South Asian countries which define themselves by not being governed by the lowlands. They exist because they are not of the government in their own ideologies. Okay, so think about surveillance. We're talking about how we bring people together, how we step people forward. How are we going to partner, co-create, and work with countries which define themselves by being not of the other, and yet are as important and vulnerable to what's going forward? And I'm going to close out with a bit actually from Edinburgh. So there's a One Health field network, which typically works in Syria, which is around food security. And I'd really suggest you look at it. They've got a lot of good stuff going on, and it's mainly about refugees that are moving to Syrian areas around One Health. But the Field Songs project in itself, and I'm sorry for reading this out, but existing research points to fragmentation of Syrian community networks. We understand that in sites of refuge because there's a real risk that expert knowledge held by the agricultural communities will be lost. We understand that there's been huge disruption. However, research have to broaden their understanding of what this knowledge might look like. One Health knowledge, what does it look like? Displaced communities' musical practices, especially traditional harvesting songs, should be considered intangible cultural heritage and actually knowledge. They are a fundamental form of agricultural knowledge. But how often do we all go and look for songs when we're thinking about the practices, processes, and risks that we're delivering? So just to close out there, the reason I put this up at the beginning, and normally I'd ask you about this one, which is team. Some of us are dry land, some of us are sea, and I point towards some of us. The bit where I think we need to be particularly interested is the intertidal. It's these very interesting areas to me where the two intersect, where you might have one system and a subvertant system, but they do come into contact. And new, creative, worrying, disruptive, interesting stuff is happening there. But how do we engage with it? How do we think it through? Because the other option is there's a real risk of doing the same thing again and again with absolutely no steps forward. Thank you very much.
Thank you so much, Alex. Thank you for giving a wonderful presentation and also talking about all these different issues that are not always heard within the One Health discourse and should be an intricate part of it. And thank you to all our speakers. Virginia has a flight to take soon, so she'll have to leave us a bit earlier than the rest. So I was wondering for the Q&A now that we're moving to that, if there's a particular question that you have for her, we'd like to prioritize those first. Just so you keep that in mind. Have we gotten any questions from the online audience? Okay, so I'd like to go into. You have to give me 1 second because I thought it was open, but.
I've got a question for Virginia, if that's all right. Whose voice isn't being heard at the moment in your opinion? Who do you need to get at the table in the room?
To understand One Health, exactly how we get that engagement. I think what's so interesting about One Health is that it's very much a movement. And it's not necessarily, as far as I can see, and I may be wrong, but it's got a multiple of UNMs, which worries me that it came up as the title. There's not one voice. And there shouldn't be one voice. I mean, your stories about those maths have made me really think hard about composting, but all that other work that we're thinking about testing this on, I think it's just brilliant. So I thought it was really exciting. So if we're going to really make a difference with One Health, get that idea of everybody working together, which I think your vision is there, and that's certainly Grant's vision and Claudia's vision. It's something that is almost bigger than we know. So it is included in the midterm review that I mentioned. It is here, but it's also with planetary goals. And I don't know which is the term that's going to resonate the most to get people to deliver the work that we need to get everybody to try and think about. And I think it's a fascinating concept, but particularly as we're heading towards the engagement with the agendas post 2030 of how it will work. Maybe this is something we should try and be nudging towards us to see how we can get One Health much more embodied inside early warnings for all and early action, but also that wider thinking that you so clearly demonstrated. And Alex, your discussion about all those different things, I thought was just stunning.
Just put it next to your.
Sorry, okay, sorry, not at all. To me, I thought it was just fascinating. Grant, all your comments about the fisheries and the man diving in. That was quite a good visual image. I mean, would you really dive into a whole bunch of dead fish? Well, you might wonder what on earth was going on. Would you come out well? I think there's so much that we haven't managed to explain properly. And I just think this session, working with the both of you and Claudia, has really enriched my thinking enormously. I wonder what the audience feels. I just thought it was fantastic, very stimulating, very exciting. But how do we make it work, Claudia?
It's a big question. Is this working? No. Do you mind? Would you mind? Thank you so much. So the online audience can also hear us. I was wondering, does anyone have any questions? Do you mind? There's these ones as well should be working.
Thank you to all the presenters. It was very fascinating and intellectually enriching and thought-provoking. What I wanted to ask, since we are talking about coordination and collaboration across sectors, across different agencies, across different fields, I was especially interested in the research that you did on hazards and reviewing all the different profiles in terms of hazards. But when we speak about coordination and collaboration, sometimes we speak different languages, right? In the security sector, as you know, I'm sure the language is threat. The focus isn't really on hazards. And sometimes when you think of, global risks, or you see think tanks or governments, when they kind of look at their forecasting or planning for global security challenges, they term it as threats, whether it's environmental threats or, cyber security threats, or, pandemic threats. And yet there was all this important work on hazards. And I'm wondering, how do we kind of align languages or terms, especially, and what are the differences, and how do we kind of coordinate the way we speak about whatever, however you want to term it, in order to work together to address those hazards or threats? Thank you.
Oh, you've asked a lovely question. Thank you. If you're in the insurance industry, hazards are called perils. If you're working in the UK government, it's called a national risk register. So your comment about how we use hazards is a really very interesting viewpoint. And I'm sure Kanza will be able to add more on this, and it would be really good if you could. Kanza, why don't you come up and join us up here, if you would? Hannah.
No pressure.
No pressure, just if you could, because I will have to go. But to me, trying to get the language common was really huge. We started off because there's been a lot of discussion about definitions for ages, and DRR have done several versions of these of the definitions work. There was one in 2007, and it was updated in 2015. Really, at the request of the Sendai framework, it's paragraph 50 of the Sendai framework, intimately known, as you can see. Carry these things around regularly with me. But the whole thing is that we spent a lot of time trying to work out what we had to define for the open-ended intergovernmental expert working group on indicators and terminology. So there's a lot of work that went in there. And one of the things we did was computational linguistics, which was trying to see how language changed. We did 10 years of reviewing all the abstracts to see how things like vulnerability and resilience and hazards, these words moved. And I think what we're living with is actually a living language. And I don't think we've got it right yet, and I don't think we can define it. I think Dr. Johnson did a very good start a long time ago, but we are certainly a long way behind. So to me, trying to look at all these different things about threats to how we use the hazards is very interesting. But what we do know is that we have to have a baseline. And I know that's where Kanza's great skills will come in, and I'm so glad you joined me up here. But the whole thing is that if you don't have a baseline, you don't know what you're forecasting against, but you also don't know what you're counting against. So we knew that the data that we put in on the number of of hazards that we were dealing with, for instance, in the UK, was very incomplete because we were putting things like excess winter deaths from cold weather. Now, is that really all we should be putting in? No. We know there's a lot on air pollution. We've got a lot of concern about that, but we also know that we get a lot of these infectious diseases, thank goodness, things like anthrax pretty rarely at the moment, although it does happen. But there are a lot of things going on, and trying to work out how to do this is really very important if we're going to get the Sendai Framework Monitor to work. So can I turn to would it be all right, Claudia, if I turn to Kanza? So can I introduce my dear friend Kanza? She works with me as a co-consultant. She is also just to sing your praises, dear. Very naughty. But she is now currently the co-chair of the Interagency Expert Group on Disaster-Related Statistics. And she's trying to work out how you use the statistics to try and measure what these things might be. And I think it's a truly exciting piece of work that Kanza's leading on. And she's been also looking at whether the HIPs actually provide the information or not that's going to work for individual countries. But we know that the hazards are not needed for every country. And of course, somewhere like Poland, you might not need sea level rise. But there's all these things that we need to think through that need to be understood. So it's getting the right hazard for the right place, but also getting them to talk to their neighbouring countries so they speak the same language, which seems to be rather important for transboundary issues. So Kanza, can I turn over to you?
Thank you. Are there any other questions? Because if not, I have one of my own.
Sorry. So just very quickly, I think, if you link back to the session this morning, and there was a sort of, the word cloud and inclusivity was sort of the big theme that came through. One of the challenges we have with definitions when we're thinking about One Health is the cultural and indigenous interpretations. And that then affects what you're counting and how you're counting. And quite often when we sort of do any kind of definitions, we take an academic definition. And it's understandable because we're looking for evidence-based. We are in the business of evidence-based medicine, for those of us who are on the public health side. But what's really important is that if we're going to engage everybody, that we've got to understand what the concept of One Health is and disasters are for indigenous populations, for local communities, and how they would count it. Because if we don't understand how they would count it, then we don't know whether the adaptations or the interventions are going to make a difference. And I think that's really important as well. Also, quite often what happens when we have a disaster is we think about the immediate sort of incidents, we think about people who've died, etc., etc. What we're not very good at the moment is measuring the long-term environmental, human and animal impact. And that's taking that integrated approach. We can give an immediate figure for a lot of things in a disaster. What we're not very good at is looking at that long-term impact. So thinking about Morocco, for example, absolutely terrible event with the earthquake over the weekend. And we're seeing all the figures about the short-term impacts, the number of people dying, the people, buildings collapsed, etc., etc. What we're not hearing about, we may never hear about outside of academic circles, is what the environmental and the animal and the human impact is over the long term, and therefore what is the long-term adaptation that needs to happen in order to bring the One Health and disasters communities together.
Add one.
Yes, of course.
Sorry, just to illustrate, I couldn't agree more. But in the communities we work with at the moment, within the manic groups, there is no such thing as zoonotic disease. Because you imply that a human could get an animal disease and that makes them less than human. So actually trying to think about disease outbreaks with disaster, you have these kind of fundamental epistemological worldview questions about you're doing something quite different. And again, within the same community, even when we were looking at getting permissions for research, we translated confidentiality as part of the research process, which came across as secret. And their only reference to the word secret is secret police. So actually what you're effectively doing is ask them to signing up to the secret police. So there are some real, I agree absolutely the language is really important, but it goes into a very, very fundamental point, I think, about how you engage or bring on or co-create or develop with individuals or communities. Sorry.
I think that's wonderful. We have one online or a few online questions.
Thanks. This is from Kamikali Kadi at the UK Health Security Agency. It's a question for Grant. So when working with communities in collaboration with government and other bodies, how do you find agreement to define what success would mean for your project, given that all sectors and parties will define success differently? Thank you.
Yeah, I mean, that's obviously a very good question. Despite the language issue we just described, I think that one of the big things we should be doing, the opportunity, if you like, is to find common denominators which we can focus these issues on, and there aren't many actually. I think we're focusing on food, water, shelter, energy, and probably health, of people as part of that One Health sort of spectrum. But if you went to any nation and you said just a simple question, which government department in this nation is responsible for feeding people? There's lots of this going on, lots of pointing at each other. Well, we do this bit, we do that bit. So even quite simple questions like that can be quite difficult to get to the bottom of. I think that One Health and this broader topic we're discussing today will only work, I think, when we apply it in that way. Otherwise, we quickly go down rabbit holes of complexity that may not even apply to another nation. But I can always guarantee the 5 things I've described absolutely will apply to any community in any nation. There might be different words, different ways of getting there, but I think we all rely on those things. So I think we're going to have to get better at taking it from this very high level UN agency kind of language that we're sort of arguing over semantics of whether to use word A or word B in the English language to the sort of worlds that you're describing. But we have to find a way of making sure that we're never straying further, I guess, from the really important life support system of the people who are discussing the topic. So that's the challenge. But even when you focus on those specifics, there are many government agencies, and I think that we don't have the Department for One Health. Maybe we shouldn't. Maybe that wouldn't work. Maybe it's that every government department, whether you're building buildings, whether you're providing food, whether you're looking after water supplies, whether you're whatever, that One Health principles are built in to your policies and your way of working, and it's an overarching, I don't know, cabinet office or high level in our country way of going about things. And government departments know to abide by those approaches. That's probably one way of doing it. But focus on that life support system. But we're not there. We can't do that at the moment, and that's why we're struggling to get traction. The other option is you go right to the community level and get the community to do it. Don't wait for government. Just I want to eat safe food. I want to eat sustainable food. No one's going to do it up there. So we'll only buy from sustainable, safe places or whatever. That's the other way. And that's, I think, if you follow people like in Exeter, there's a Global Systems Institute, which they call it positive tipping points. How do you create the movements of people to do those things, regardless of what governments are ready to do? That's another option. But there's different processes there.
Thank you. If I could add something as well, within DEFRA, we've been thinking a lot about what does it mean to implement One Health within DEFRA. Part of what we've been doing is doing these workshops quarterly on operationalizing One Health, looking at things like metrics and evaluations, who needs to be involved, how can we create a team of One Health champions. And I think, well, I've been in government for the last only 2 years, but only within those years I've seen already like a significant change in like how people are involved, in how people understand One Health, and in the proactiveness to think differently. So for me, that's very encouraging. Is there any other questions? Because we're running out of time. So ask now or never ask again. Yes, go for it. Or, yeah.
You mentioned about reindeer up all the Russians, but it's Ice Age animals. And I was just wondering, in response to these reindeer herds, the people that have kind of found their own solution, which is to utilize this mammoth ivory and sell it on the black market, possibly for huge sums of cash. So in a sense, these people have already responded to this disaster, and they found a solution which might go against kind of the ethos of what you're trying to do. So how do you kind of implement that into your work, a solution to a problem that you might ultimately disagree with?
I'm fascinated in what you think I do. I mean, on that, I completely, I think we probably can't say it's permafrost anthrax that causes all these losses. as with all of these things, vaccines were stopped in 2007. There's different migratory movements. There's different carrying capacities in certain areas. So these are big multifactorial questions. So I think part of one thing I fight against and have been for years, and this is not our conversation, it's broader, is the idea of linearity of a narrative that goes from A to B is very rarely the truth. And for example, if you're talking about selling ivory, certain members of the community will be able to sell it to certain other gangs in certain other areas with or without the permission of local government. So I think what it does is provide a useful way into thinking about that community, things like food insecurity, different areas. And I think I'm already being unhelpful by saying that community, in the sense that there is different gender, economic, educational elements to those communities, different cultural forms, which will all influence what's going on. What I was trying to do, I think, was use this as an example that there are very well developed, very creative, adaptable systems going on all around us, which intersect or touch onto the formal ones that we've talked about and we'll continue to talk about for a couple of days. And I think we need to be at least cognizant and at best more interested, creative and curious about what this actually means. So I don't think proposing a solution. What I'm looking at is that these are interesting dynamics. How and what do we engage with? And I think the question about risks, the biggest problem I've got is the fact that in order to handle these things as humans, we attribute them to one of the 309 risks. I've never seen a single risk that will operate in isolation. And that includes things like space weather. These are huge, complex interests, but how do we make them tractable to what's going on? And one of the biggest problems we've got is we make them tractable to the systems we currently have. The military are a classic example. I will do this, I won't do this. I will intervene at this point when this threshold's hit. Ultimately, with new risks and emerging understandings, potentially we need new systems. Does that not answer that question well enough?
No, it's good. Good, thank you.
Thank you. With that, I'd like to bring this session to an end. Thank you to all our speakers for all your presentations, Alex, Grant, Dame Sally who joined us online, Virginia, and also Kanza for that very nice final appearance. And thank you for this wonderful session. I think really the point of it is to showcase how we can implement One Health from different lenses and ground that in different examples linked to food systems, to security, to health, to infectious diseases. And how wonderful all of you to join us. And thank you so much for the One Health team as well in DEFRA for supporting this. Thank you.